First part class. What are the muscles of the anterior abdominal wall? Anyone? Yes, anyone? What are the muscles in the anterior abdominal wall?
External oblique, internal oblique, transversus abdominis.
Anything else which is left? Three muscles. Apart from that, any other muscle in the center?
Rectus abdominis.
Rectus abdominis. Okay. Okay. So today, I hope you know the origin, insertion, how they are placed in the abdomen. And today we will be discussing the inguinal region. So today we will see the inguinal region. Okay, you just draw. Suppose these are this is the symphysis. Okay, these are the anterior superior iliac spine. This will be the pubic tubercle. And so what is this ligament running like this? From pubic tubercle to the symphysis pubis. What is this ligament? Yes? Because this is the umbilicus.
Inguinal ligament.
Inguinal ligament. So this is anterior superior iliac spine. Somewhere here is the pubic tubercle. Okay. Now, when we discuss the inguinal canal, now this is a canal which is lying from here, okay, till an opening here. So the canal lies like that, okay, opening here, another opening here. So the canal lies like this, okay. So from this, the spermatic cord, in case of males, it passes, and in case of females, it is the round ligament. Okay, so this is the inguinal canal, which is located. See where it is located? It is located in the medial half. So if you divide it, it is located in the medial half of the inguinal region, just above the inguinal. So this is the inguinal ligament. Inguinal ligament, okay, and it starts from, this is the deep inguinal ring, and whatever lies superficial is the superficial inguinal ring. Now these rings are nothing but openings. So we have got a deep inguinal ring, we have got a superficial inguinal ring, the spermatic cord or the round ligament of uterus, it enters the deep inguinal ring, it travels in the inguinal canal, and it escapes out from the superficial inguinal ring. Now it will go, so it will go in case of males, so epididymis ऐसे करके it will go to the respective, okay, the testis, isn't it? In case of females, the round ligament of uterus, it travels here. Okay, so if you want to draw it, so suppose the uterus is like that here, okay, it will be little down. So the round ligament of uterus like that, okay, it will pass to the labias. Understand till here? Yes, anyone? If you going to define, if you are going to define the inguinal canal, so this is a musculo-aponeurotic canal. So it consists of muscles, okay, and aponeurosis. These aponeuroses are derived from the abdominal muscles. These are also abdominal muscles. So this is a musculo-aponeurotic canal which lies in the medial half, okay, of, you can say, the inguinal ligament, starts from the deep inguinal ring, ends in superficial inguinal ring. In case of females, the round ligament passes. In case of males, the spermatic cord. Okay, so if you see the contents, the first is, in case of male, it is the spermatic cord. In case of female, it is the round ligament, and these are full content. It extends till the full extent of the inguinal canal. Okay. Now there is another content which is partial. What is that? That is, it won't be 3, it will be 2 only. Okay. You can say this is, you can write 1A or 1B. This is partial content, ilio-inguinal. Okay. So till here I guess it's okay. In case of male, spermatic cord. In case of female, round ligament, and the ilio-inguinal nerve is the partial content. Okay, so it can be seen, isn't it? Now here the important thing over here is to know what are the muscles, since it is a musculo-aponeurotic canal, what are the muscles and what are the aponeuroses which are forming this tunnel. Okay, so let us just move on to another picture. So we are discussing the inguinal canal. Okay, so everything is happening around the hip bone, isn't it? So if you see the hip bone like that, suppose this is the anterior superior iliac spine, then let us make this is the pubis. This is the symphysis pubis of the other side, pubic tubercle. Okay, somewhere here will be umbilicus. This is the linea. What will be this? Linea alba. Umbilicus. Somewhere here is the linea alba. Anyway, you see, so if this is the anterior superior iliac spine, this is the pubic tubercle. Okay, now the external oblique aponeurosis, okay, it rolls upon itself, okay, to form a thickening starting from the anterior superior iliac spine, okay, till the, so this is the inguinal ligament, okay, which runs from the anterior superior iliac spine till the pubic tubercle. Okay, so it runs from the, so this is the pubic tubercle. Now this ligament is like that. Okay, we can say this is having a concave margin okay, concave margin down. So it is sort of, I don't know whether you can make it out or not. I'm trying to draw the concave margin down. So what is this? This is the inward rolling, this is the inguinal ligament which is being formed by the inward rolling of the aponeurosis of the external oblique. Okay, I am trying to make it look like this is having a concave. Okay, so it's like I've drawn it like that. It is having a concave margin like that. Okay, like this concave margin. This is the inguinal ligament. Okay, starting from the anterior pelvic spine to the pubic tubercle. Now, if you just let us, we don't know this. Now, if you see here, there are some muscles which are taking origin from the inguinal ligament, isn't it? As well as the iliac crest over here. So, we are just going to draw layer by layer the different muscles. First, let us go with the external oblique. So, the external oblique muscle is the outermost, which lies the outermost will be, so it is converted into an aponeurosis. Laterally it is a muscle. As it comes medially, okay, it becomes an aponeurosis. So as it comes down, and medially, so it becomes an aponeurosis here, okay, like this. So this is the external oblique muscle. So this is the external oblique. See, below that is the inguinal ligament down, okay, so it will, and in front this is the external oblique. Okay, what is the next muscle? Anyone? What is the next muscle?
Internal oblique.
Internal oblique. So
Internal oblique.
yeah, we will just draw the internal oblique here. Okay, next is the internal oblique. You won't make it that thick. Okay, this is just the internal oblique, a cut section. Okay, so this muscle, so internal oblique is also taking origin from the inguinal ligament, isn't it? So it is taking origin from the inguinal ligament. So down here somewhere the internal oblique is taking the origin, isn't it? From the inguinal ligament. Okay, we know that. What is the next muscle? The
Transversus abdominis.
transversus, yeah. So we'll just try to draw. I'll try to draw. Now transversus, you see, it lies, okay, lateral 1/3 se aayega, but then there is, okay, it doesn't come much over here, transversus. So let us just, so it comes like this. Okay. Now, next is something, what I should give the color, which color? Okay, let it be green. So there is a fascia which is known as the fascia transversalis, okay, so, which lies like that, covering the all throughout. It will lie like this, the fascia transversalis. Okay, so this layer is the, understand till here? So this is the external oblique, this is the internal oblique, this is the transversus abdominis, and this is the fascia transversalis. Now just posterior to the fascia transversalis, we are having extraperitoneal fat. Okay, these yellow color ones are the extra, I'll just write it down. These are extra peritoneal fat. Okay, so outside the external oblique, skin superficial fascia is there. It's already there. Now, next, let us just take, okay. So, and this is the, this layer is the peritoneum. Okay, this layer is the peritoneum. See, these are very thin layers, but to make you understand, I am just making it a big little, okay, thicker. So this is the peritoneum. Okay, this is the peritoneum. Okay, so many layers are there. You see what happens. So this is the general peritoneal cavity. यहाँ पे सारा the intestinal loops, okay, all those organs, ठीक है, all those organs will be there, the intestine and all. Okay, so this, till this picture, I think this part is clear, isn't it? Is it clear till here? Yes?
Yes, sir.
Now you see, when the spermatic cord, see now the area for the inguinal ligament is somewhere here in the medial half, isn't it? So when the spermatic cord comes like that, it is coming like that. Okay, when the spermatic cord is coming like this, there is an oval slit. There is a slit where in the fascia transversalis. Okay, this slit is known as the deep inguinal ring. Okay, through this deep inguinal ring, I'll just remove this part. Through this deep inguinal ring, the spermatic cord will come out. Okay, you understand? So this is a slit which is known as the deep inguinal ring. Now through this deep inguinal ring, the spermatic cord has come out. Next, it has to travel. Okay, where is the deep inguinal ring located? It is located 1.25 centimeter above the mid-inguinal point. Now here you have to understand two terms. First is mid-inguinal point and another one is the midpoint of inguinal ligament. Now the mid-inguinal point is starting at anterior superior iliac spine till the symphysis. That means from here till here. You find out what is the midpoint, so that is the mid-inguinal point. Now midpoint of the inguinal ligament will be from anterior superior iliac spine, since the inguinal ligament starts from the anterior superior iliac spine to the pubic tubercle. So this will be a little short. Inguinal ligament is short as compared to the whole of the inguinal region. Okay. So the midpoint is between the, so it will start from axis, anterior spine to the pubic tubercle, middle in between them. Now the deep inguinal ring is in the mid inguinal point. Okay. 1.25 centimeter just above the mid inguinal point. So you have to, it's important you understand these two terms. Now when it comes further, it will come like that, isn't it? It will come like that. Okay. Then I'll just draw in dotted lines. It will pass like that. It will pass like this. Sorry, those were dotted. This is, it has come. Again, I'll draw some dotted lines since it is posterior to the, what is this muscle? External oblique. So it will come and it will come and it will escape like that. Okay. From where it will escape? From this. So this was the deep inguinal ring. So this area, this opening is known as the superficial inguinal ring. Okay. You see the pubic tubercle lies lateral to the superficial inguinal ring. So again, the spermatic cord is coming from there. Okay. Now this spermatic cord is entering through the superficial inguinal ring, which is an oval slit in the fascia transversalis. Okay. From there it will come like that. It will pass like this. Then it has come down again and it will exit from the superficial inguinal ring. So see, it lies in the medial half. What is the length? The length of the inguinal canal is about 4 centimeter. Okay. Now I'm just going to, so you have understood what is superficial, what is deep inguinal ring, isn't it? I'm just going to, so this was the fascia transversalis. यहाँ पे, yeah, this was the peritoneum. This is the extra fascia transversalis. Okay, the whole of it is fascia transversalis. So I think this still here you have understood the layers, different layers. Yes.
Yes, sir.
Okay. Now you see, when we see the, so this part from where the, from till deep inguinal ring to the superficial inguinal ring where the spermatic cord travels, it forms a canal, and this canal is known as the inguinal canal. Okay. Now if you look at the inguinal canal, you will see that all throughout the fascia transversalis is forming the posterior boundary, isn't it? So let us just discuss the boundaries, then it will be a little clear. Boundaries. So there will be an anterior boundary, there is a posterior boundary, there is a roof, there is a floor. Okay. Now if you look at the posterior side, you see and consider this part as the inguinal canal. The posterior boundary all throughout, I'll just mark it green, so formed by fascia transversalis. Okay, the fascia transversalis forming the posterior boundary. If you look at the anterior boundary, if you're looking at the anterior boundary, so there will be, of course, the skin, okay, the superficial fascia along with the skin. And what is this muscle? You see, what is this muscle forming the anterior boundary? Kindly respond. What is this muscle? What is this anterior boundary? What is this muscle?
External oblique
muscle.
This is the external oblique. So this is the external skin, superficial fascia. This is the external oblique muscle. Now if you look at it a little closer, you'll find a part of internal oblique is also coming. Isn't it? A part of internal oblique is also coming. Isn't it? So here also the internal oblique. Skin, superficial fascia, external oblique, the internal oblique. It is making the anterior boundary. Okay. Posterior boundary, till now we have seen this is the fascia transversalis. Okay, now there is another catch to it. Now you see all these fibers of the internal oblique doesn't go like that. The fascia, the transversus abdominis as well as this internal oblique, what they do is that they will sort of, some of the fibers from here, they will converge like this. Okay, they will converge like this. Some fibers from the transversus abdominis also, they will come. These two fibers, they will combine. Okay, and they will go up like that to form the conjoint tendon. Now this conjoint tendon will go up, and again it's going up, and again some of its fibers will come to the opposite side. So they are coming like that. Okay, the conjoint tendon is coming like this. So what is the conjoint tendon having? Both the fibers of the internal oblique as well as the transversus abdominis. Okay, they will form a wall, something like that, which goes up, okay, and forms a wall like that. You understood this part?
Yes, sir.
So it is taking a turn. Okay, taking a turn. Now, what was this? This was the fascia transversalis, isn't it? All throughout it was the fascia transversalis, isn't it? इसके सामने क्या आ गया? The conjoint tendon. So this is the conjoint. What is conjoined here? The internal oblique. See, the internal oblique and the transversus abdominis. So you see this conjoint tendon is also forming the posterior wall, isn't it? So in the posterior wall, conjoint tendon. Where? In the medial half of the canal. Okay. Now see, initially these fibers were roofing over here. They were roofing, then they were turning and going back, isn't it? These fibers are roofing first, then they are turning and going back, isn't it? So these fibers of internal oblique and the transversus abdominis, both of them are forming, so internal oblique tendon and the transversus abdominis is forming the roof. Okay, so this is the canal. Okay, the inguinal ligament with its concave sort of, okay, plate like concave superior margin. So this is forming the floor. So the inguinal ligament is forming the floor here. So till now, is it understood? So if you see the anterior boundary, skin, superficial fascia, I have not drawn all those. That is understood. Then the external oblique, this is the external oblique muscle, and the internal oblique. Okay, and then not all throughout. Okay, not all throughout. The internal oblique is forming it in the lateral 1/3 only. Why? Because after that it forms the conjoint tendon. Okay, posterior boundary, all throughout, this is the fascia transversalis, all throughout, fascia transversalis. And in the medial half, see, this is from here, the inguinal ligament is from here, canal is from here till here. So in the medial half only, the conjoint tendon is forming the posterior boundary. Roof, together the fibers coming from the internal oblique as well as the transversus abdominis. Floor, all throughout the inguinal ligament. Okay, the superior concave surface will be forming the floor. Now, one point again, the inguinal ligament will somewhere here, so it will turn like that medially. See, if the inguinal ligament anterior superior iliac spine and it is like this, so inguinal ligament is like that, so it just turns medially and posteriorly to form the lacunar ligament, like that, the lacunar ligament, okay, which will run in the pecten pubis. So this lacunar ligament, so the whole of the pubis is like this, isn't it? So this is the, like that, anterior inferior iliac spine like this. So there somewhere is the pecten pubis, lacunar ligament is attached here. This is known as the pectinate reflection or the Cooper's ligament over here. So the lacunar, so floor is formed by the inguinal ligament as well as the lacunar ligament here, which will turn like that, first medially then posteriorly. So it is the lacunar ligament which is forming the floor. Okay, now to be more a little more in detail, there are some fibers running from the inguinal ligament and moving like that, moving like that. So this is the reflected part of the inguinal ligament. Okay, this is move and they are going to the opposite side to meet in the linea alba. This is the reflected part of the inguinal ligament. So in front of this conjoint tendon, which is forming the posterior wall. So just in front of it, this, I'll just write it here. So this area, this is the reflected part of inguinal ligament, which is also forming, see which wall it is forming, if the spermatic cord is running like that, so it is forming, you can see in the medial fourth, this is forming, so reflected part of inguinal ligament, okay, this part, okay, this part, let us just, reflected part of inguinal ligament, so this is the reflected part of inguinal ligament, this is forming the posterior wall, okay, so all throughout this is the posterior wall, all throughout this is the anterior wall, floor, and this is the roof. So till here, is it understood?
Yes, sir.
Okay, so you know the boundaries, isn't it? By now you know the boundaries. We will just move a little further. So, okay. So there are again some considerations here. Okay, if you want to go into the details. Now you see this is, I have drawn only the spermatic cord. Okay, spermatic cord. An artery, which I have already told is the partial content. Okay, so this artery will also come along with that. What is this artery? What is this artery? I have already told. What is this artery? Content of the inguinal ligament, partial content. What is this? Come on, anyone. Tell me the partial content, not the full content. It will pierce the fascia transversalis and it will occupy the half of the inguinal canal, the partial content. What is this artery? Yes, anyone?
Ilioinguinal.
So this is the, this is not the artery, this is the nerve. Ilioinguinal nerve. Okay, this is the partial content. So ilioinguinal nerve, not an artery. Okay, this is the partial content. Now, when this spermatic cord, it is coming and passing through the different layers, different muscles, different aponeurosis, now it takes upon itself a part of the different muscles and the aponeurosis. Like suppose first it passes through the deep inguinal ring where it is situated 1.25 centimeter above the mid inguinal point. Okay, so some of the fibers of this fascia transversalis, okay, it will pass on to this spermatic cord. You getting my point? Some of the fibers will pass on to the spermatic cord and this will form the internal spermatic fascia. So all throughout that internal spermatic fascia will be along with it. Okay. Next, see the transversus abdominis doesn't come till here. I have just drawn for the sake of making you understand how it forms the roof in the same picture. Next will come the internal oblique. So it passes through the internal oblique. Some of the fibers from the internal oblique will pass to the spermatic cord. Okay, and these fibers, these muscles from the internal oblique which passes to the spermatic cord is the cremaster muscle derived from the internal oblique. Okay. Now, when it comes out through the opening of in the external oblique aponeurosis, which is the superficial inguinal ring, okay, which lies medial to the pubic tubercle, it also takes some part of fibers from the external oblique. Okay, and this is known as the, so this was internal spermatic fascia, this is external spermatic fascia. Understood? Now if you, I'm just making it a little round. Okay, if you make it a little round, then the first layer outside it which has come, वहां से क्या आया था? Internal spermatic fascia, isn't it? इसके ऊपर क्या था? The cremasteric muscle, isn't it? इसके ऊपर क्या था? The external spermatic fascia. The green one is the internal spermatic fascia derived from the fascia transversalis. The blue one is derived from the internal oblique, and that is cremasteric muscle. The light blue one is the external spermatic fascia derived from. So it's like if you insert a finger through a polythene, you are taking the layers along with it. Okay, so this is how the different layers of the spermatic cord is formed. Okay, so till here you have understood? Yes, you have
Yes.
understood till here?
Yes, sir.
Okay, so any doubt I can again repeat. If you are having any doubt here, I can again repeat things. So do you need me to repeat things here?
Yes, sir.
So which part you didn't understood, and which part I need to repeat again? Tell me, because we are going to the clinical now. We'll be going to the clinical, so without understanding this part, it will be difficult for you to, when I go into the clinical part. So which part you have not understood? Beta log batao, otherwise I won't know na which part you are having confusion. So you see, okay, you are not saying anything, I'll move forward. So this is the general peritoneal cavity. Okay, this is the general peritoneal cavity. Now we are going to discuss the hernia. So since this is the inguinal region, we will be discussing the inguinal hernias. Okay, you see, hernia, it is a protrusion of an abnormal sac through any abnormal opening which is otherwise not present. Okay, when there is an abnormal protrusion of a sac through an abnormal opening, that is known as a hernia. Okay, now femoral hernia you have already gone through. Now here this is the inguinal hernia. If you would have been shown a little response, I would have made things clear over here about the femoral and the inguinal, but since you are not responding anything, I'll just end up telling you about the inguinal hernia. So you see, the inguinal hernia, the one can be, let us just choose. So one can be, you are going through, the contents are going through, entering through the deep inguinal ring, coming out through the superficial inguinal ring, traveling all throughout this. Okay, so when this happens, this is known as the indirect inguinal hernia. Okay, so suppose there is a viscera coming like that. Okay, the viscera is entering through the superficial deep inguinal ring, and throughout it is coming and coming throughout, all throughout, along with the spermatic cord, and it is coming out through the superficial inguinal ring. Now that is indirect inguinal hernia, sometimes also termed as oblique. Okay. Now, if you see second one, so first one is indirect inguinal hernia or oblique inguinal hernia. The second is, first is indirect, then other one will be direct, isn't it? So now here again, so this is the peritoneum, isn't it? So any abnormal, suppose there is a loop of the same thing, any intestinal loop, okay? So from here, it is coming, bulging out, it is bulging out and giving pressure over here in the posterior part of the क्या बोलते हैं fascia transversalis. So again it can come like that, it will travel like that, it will travel like this, it will travel like that, and ultimately it will come out like this. So this is the direct inguinal hernia, which comes and gives pressure directly from the posterior wall. Okay, so here there is again another key, another catch over here, that is an artery which is traveling like this. Okay, it is traveling like that and sort of creating a triangle like this, and this triangle is known as Hesselbach's triangle. Just see the spelling, I am doing spelling mistakes most often. So this is the Hesselbach's triangle. Now if an hernia comes, okay, this triangle is formed by this is the inferior epigastric artery. Medially there is a muscle rectus, okay, so lateral wall of the rectus, and inferiorly this is the inguinal ligament. Okay, if a hernia comes from the like that, from the deep inguinal ring, passes like that, so it usually passes lateral to the Hesselbach triangle. So usually the indirect oblique hernia are lateral. Okay, for the direct hernia it will come somewhere here and will pass like that. So the direct hernia are medial, I mean inside the Hesselbach triangle. Okay, so that is the clinical importance of Hesselbach triangle, which is formed by the inferior epigastric artery, the medial side or linea semilunaris, you say, the medial, the lateral border of the rectus. Okay, so this is the importance of the. Now let us see, lastly, let us see, so sometimes what happens, there is this indirect inguinal hernia. This is usually, see, the whole of this inguinal ring, the inguinal canal is being formed when the processus vaginalis enters, and it takes along itself the different layers till the scrotum. Okay, so it's like, I'll just draw here. It's like superficial inguinal ring, this is the deep inguinal ring. So the spermatic, suppose this is the testis over here. What happens? The covering of the testis is formed by the peritoneal part, which is going down. So it passes through the superficial inguinal ring, deep inguinal ring, and then over here. Okay, this is the peritoneal reflection when the testis is descending, and ultimately what happens? This connection is lost. Okay, only what remains is only this processus vaginalis. Okay, the rest of it is lost. But if the rest is present, okay, usually happens with the indirect, because this is the passage originally from where it was coming. So this leads to congenital condition where there is indirect inguinal hernia. Okay, this may be patent till here. Okay, it may happen that it is patent till here. This is a superficial inguinal ring and there is just an communication like that. Or it may happen that, okay, it is communicating all throughout. Okay? So the congenital part is usually the indirect or oblique hernias. Okay? So till here is it okay? Again you won't respond anything, so I'll move.
Yes, sir.
So if we see the different layers, of the indirect inguinal hernia, so when you examine a patient, you examine this, you can see through the scrotal sac, you give a pressure, you can, if the superficial inguinal ring is laxed, okay, usually what happens, the cause of hernia is the lax abdominal musculature over here. In old age, usually it is seen, or in chronic conditions like chronic cough, constipation, where the patient is doing, there is increased intra-abdominal pressure very much frequently. So there is loss of the tone of the muscle of this external abdomen, all this musculature. So when the tone is lost, it leads to it makes the patient more probable for having this kind of hernias. So by seeing the different layers, you can say, or by involvement of the different layers inside the hernia, when you are going to reduce the hernia, you can say that this is indirect and this is direct. So in indirect, let us just, so it becomes very easy. So indirect, the first layer will be the, what is this? Anyone? What was that? This was fascia transversalis. Along with the fascia transversalis, what is the layer which is coming along with the spermatic cord? What was that?
Peritoneal layer.
No, this is this green one. How can it be peritoneal layer? What is this green one?
Internal spermatic fascia.
Internal spermatic fascia. Very good. So now, suppose, so intestinal loop has come like that. Okay. So, यहाँ से अगर intestinal loop will come, okay, like that. So, the first layer it will cover will be this, isn't it? It has to give pressure over here, isn't it? So, what is that first layer? What is this layer? The peritoneum, isn't it? This one, peritoneum. Next, यहाँ पे छोटा छोटा क्या था? ये सब extra peritoneal fat. So it will give pressure on the extra peritoneal fat. So second becomes the extra peritoneal fat, isn't it? First, second, third. Now this we are talking about the indirect. So it has to travel through the deep inguinal ring. So this will take this green layer along with it, isn't it? What is this green layer? The internal spermatic fascia. After that green layer, what will take along with it? This blue one, the cremasteric muscle. What is the next? Is external spermatic fascia. Till here you have done, isn't it? After that there will be the tuning processus vaginalis and the dartos muscle and all. Okay? Now the same thing if it happens from here, if we see it for the direct. Okay, the first, it has to take the peritoneum. So the first is the peritoneum. The second will be the extraperitoneal, because these two are extraperitoneal fat. These two are something which cannot be avoided. The third, it is not going through the entire this deep inguinal ring, isn't it? So it will direct give pressure here. So the third will be not the cremasteric muscle but fascia transversalis. Okay, or if you go more medially, if it happens here, so पीछे से pressure देगा तो क्या आ जाएगा? Conjoint tendon. If it is more medial तो क्या आ जाएगा? Reflected part of inguinal ligament. The rest will be same. Cremasteric fascia. Okay, then external squamatic fascia. Okay, the rest layers will be same. So this you are going to need this till your surgery, until you become surgeon, if you are going to become. Okay, so this anatomy is very important. If you are going to operate, unless and until you know the anatomy, you won't be able to do anything in a patient with inguinal hernia. Then you have to know how to repair it. There are different layers of the lacunar ligament which are used. The reflected part is also used, okay, to repair the different kinds of hernias. I think for today it's okay. You have understood?
Yes,
Yes,
sir.
sir.
Chalo. Thank you all.